Thank you all so much for joining today's webinar entitled Navigating Newborn Screening, Why Early Detection and Diagnosis Are Crucial. My name is Nikki Young, and I'm a program manager for the Child Neurology Foundation. Today's talk is part of our 2021 education series. Each topic focuses on what we heard from our partners and our families as a top priority. So first, I'd like to thank our 2021 education series partners. Without them, this wouldn't be possible. Our sponsors are Amicus Therapeutics, Bluebird Bio, Greenwich Biosciences, VNS Therapy by LivaNova, Origin, PTC Therapeutics, Regenix Bio, and UCB. Thank you for your support. So for today's presentation, we'll be hearing from Marianna Raia, Associate Director of Programs at Expecting Health, and the Program Manager for the HRSA-funded Newborn Screening Family Education Program. After Marianna, we'll be hearing from Amy White with Mayo Clinic and parent Stephanie Mustin to share their experiences and advice for families coping with an early diagnosis. So with that, thanks for taking the poll. I will pass it over to Marianna.
Awesome. Thank you so much for that, Nikki, and thank you all for joining. It is such a privilege to be a part of this amazing panel, and I feel very fortunate that I have the opportunity to share with you a little bit more about some of the work that we're doing at the Newborn Screening Family Education Program, and it's really great to hear excuse me, that we have several of you in the audience who are interested in learning a little bit more about newborn screening, because I think we'll have that opportunity to do so today. So I recognize, and thank you, Nikki, for the introduction earlier. As she mentioned, I am Marianna Raia. I'm the Associate Director of Programs at Expecting Health, but I'm also a genetic counselor. And so through my career, I have found myself in the very fortunate position of getting to work very closely with families, not just in the newborn screening community, but also in a number of rare disease spaces as well. And throughout all of my work and experience, I think the most important aspect, and what much of the work that we do at Expecting Health is focused on, is really ensuring that family voices are a part of navigating complex systems. And so I think you'll hear just a little bit more. I'm excited to share a bit with you today about the work we're doing at the Newborn Screening Family Education Program, which really is one of the core programs supported by Expecting Health and dedicated to ensuring families have access to resources, knowledge, training, and education that they might need to navigate through their newborn screening journeys. So next slide, please, Nikki. So before I jump in, I do want to disclose that, again, as Nikki mentioned, the work of the Newborn Screening Family Education Program is funded through our partners at the Health Resources and Services Administration, or HRSA, and we're very grateful for our partnership with HRSA to enable us to do this extremely important work. Next slide, please. So I think it's important to just understand from a program perspective, what is our vision and sort of mission at the Newborn Screening Family Education Program? And we certainly recognize that newborn screening is a process that is done on a very regular basis, with over 4 million babies getting screened annually. But we also recognize that while it's something that happens on a very regular basis, many families are not equipped or don't always have the knowledge and awareness of what is involved in newborn screening, and specifically within the newborn screening system. And so our vision here at the program is that we create an environment where all families, regardless of their background, regardless of where you deliver, regardless of the state that you might live in, all have equitable access to newborn screening information, and really have the tools that you need to navigate that system when you need them. And so the way in which we're accomplishing that vision, or working towards that vision, is through a 5-year program, and we're actually just wrapping up our 3rd year of this work. And through this work, we've created a comprehensive newborn screening training program, and I'll touch on what's included in that training program in just a moment. But really the program and a number of the other activities that we host and invite families to participate in is really to create, again, that environment where we're providing information, training, and education so that families feel more confident to advocate for themselves, for their families, for their communities, and really to serve as leaders throughout the newborn screening system. Next slide, please. So newborn screening is really considered one of the longest running and most successful public health programs. And many other screening programs actually look to newborn screening as a model. And just for some background for those of you that may not be as familiar with some of the history of newborn screening in general was initially started in the 1960s when Dr. Robert Guthrie developed a blood test that helps screen infants for a metabolic condition called phenylketonuria, or PKU. And while much has evolved and changed in the world of newborn screening since those early days, we still, all work towards the same goal in newborn screening, and that is really to identify infants who are potentially impacted by rare by conditions that cause significant health concerns, and to identify those infants and children as early as possible so that the appropriate interventions and care can be introduced. Next slide, please. So specifically, what is newborn screening? Oftentimes, I think people think of newborn screening as a blood test that is typically done within the first 24 to 48 hours of a baby's birth, and that is absolutely a part of newborn screening. But what often isn't part of general awareness and education around newborn screening is that it's actually a group of screening tests. So in addition to a blood test or a sample of blood that's collected typically through the baby's heel within that first 24 to 48 hours, the blood test again screens for specific conditions that may put babies at risk for serious health complications, and early identification of those particular conditions can allow for earlier care and treatment and prevent more serious outcomes from happening. But it's also comprised of two other pieces of screening or parts of screening that take place. So the second part of newborn screening actually involves an evaluation called pulse oximetry, which assesses babies for potential heart defects, congenital heart defects. And essentially, pulse oximetry is used to measure the levels of oxygen in a baby's blood, because identifying if those levels are out of range or abnormal can certainly indicate if there might be an underlying heart problem that is of more concern. In addition to pulse oximetry, there is also a component of a hearing screen that takes place within that first 24 to 48 hours. So typically, all three parts of newborn screening are done in the hospital before a baby goes home. And if a baby is not delivered in a hospital, then arrangements are typically made prior to that child's delivery to ensure that newborn screening is completed. Because again, identifying, this is a very important part of a newborn's first few days, and ensuring that we identify babies who have these conditions so that we can start treatment early is incredibly important. Next slide, please. I think another really important component when learning or thinking about newborn screening is that newborn screening is more than just a group of screening tests. Newborn screening is actually a quite complex system. And for those of you that are already involved in the newborn screening system, this likely resonates with you. And from this slide here, you can really see that there are very specific touch points throughout the newborn screening system, and many different individuals or groups of individuals that are involved along that process. So in some cases, families may first be introduced to newborn screening during a pregnancy. And based on research and data available, we understand that learning about newborn screening during pregnancy or even prior to pregnancy is the ideal time. But the reality is that most families don't learn about newborn screening until it's either happened or they've received a call regarding a potential out of range result. And these can be very, very difficult calls to both make and receive. For families that may receive out of range results, another component in the system is the follow-up process that is then required. And in many cases, either repeat newborn screening or confirmatory testing is needed to really determine if a child that has had an initial out of range result truly has that condition. And certainly for families that receive a diagnosis of a particular condition through newborn screening, have both short-term and long-term management that then becomes a part of their kind of every day. And so when we think about each of these different parts or pieces of the newborn screening system, you can also start to understand that along that process or along the way, there are truly a number of different groups of individuals that may interact or be a part of that system. So that includes healthcare providers, that could include state laboratories or specific follow-up programs. That certainly includes parent and advocacy organizations, who I know we have a lot of you listening in today. And this list is in no way comprehensive of all of the components that are involved or all of the stakeholders that are involved in newborn screening. But I think what really is important to remember is that while this is an extremely complex system with many places and groups that are involved, the one consistent through each phase of this system are the families that are impacted by newborn screening. And so I think that, again, from Expecting Health's perspective, and specifically the Newborn Screening Family Education Program, we really want to emphasize that families should be involved and an integral part of every step of developing tools and education throughout this system. Next slide, please. So that really brings us to kind of the work of the Newborn Screening Family Education Program. And as I mentioned earlier, this work was initiated about 2 years ago, but based off of a number of other works that had been done prior to this particular program. And through this, we've been able to connect families with resources, help educate and train families as they've navigated their own newborn screening journeys, and really helped to develop those families' leadership and advocacy skills along the way. So one of the things we wanted to make available to all of you today, this is again, not a comprehensive list of all newborn screening resources that are available, but some of the key resources that we really think of and groups that we partner with through this program. So for anyone that might be interested, and we'll make sure that you all have access to the links for these organizations, but for anyone that might be interested in learning a little bit more on your own about newborn screening, what you see here, the Newborn Screening Information Center, as well as Baby's First Test, are really focused on providing you all with information specific to conditions that are included on different state newborn screening panels, as well as information about the process and logistics of newborn screening and much more. And then the other 3 resources that I have listed here, Family Voices, Hands and Voices, and the National Center for Hearing Assessment and Management, are all family-led organizations that really look to support families throughout their journeys within newborn screening, but also in rare disease as well. So they're great resources, and I definitely encourage you all to check those out. Next slide, please. Specifically through the Newborn Screening Family Education Program, we have created a great tool that is accessible to anyone who might be interested in learning more specifically about the complexities of the newborn screening system, but also as you might be thinking about or experiencing, long-term follow-up and management within that very complex system. We've developed through some of our initial needs assessment work and listening directly to what families wanted and needed, an online training module. And in just a moment, I'll kind of walk through what's included in that. But really, this module was designed, again, to help specifically families who want to learn more about newborn screening have access to that deeper, more detailed information. It's also a way that we can and have helped facilitate connections across the newborn screening community. So I think oftentimes if you have a child who might have been diagnosed with a condition through newborn screening, you often connect with other families who may have a child with the same condition. And through the work of the Newborn Screening Program, we've actually helped to connect a number of families within the newborn screening system, share their stories, and sort of develop strategies for support that may not be specific to a particular condition. And the other component of the Navigate Newborn Screening online curriculum is that it's really designed to help develop education and knowledge around advocacy skills as well. So again, you'll see here, and we'll make sure to include this in the chat box as well, but we have a specific enrollment key available to everyone through the Child Neurology Foundation. And so this module, you can advance to the next slide, is free, and it's accessible at any point in time to anyone who might be interested. just some general information so you kind of know what to expect, and can hopefully check it out if you wish. It takes about 40 to 45 minutes to complete the entire curriculum if you're interested, but it is self-paced. So it's broken into subsets or smaller courses. So no course is longer than about 7 minutes, and you can log in or log out at any time that you want. You can actually access this training or this educational module from a mobile device, from a desktop, from a variety of different formats. And again, you can kind of go at your own pace and pick and choose which pieces of content you may want to learn a little bit more about. So the initial 5 courses that are included really focus in on defining what newborn screening is, more information about understanding the newborn screening system, understanding the different stakeholders that are involved in the newborn screening system, both at the federal and the state level, and then also developing those storytelling and advocacy skills that are so important to navigating through the complex system. Next slide, please. And so as I wrap up, because I definitely want to leave lots of time, we have a lot to learn from Stephanie and Amy, but I wanted to just leave you with a few specific things that you can specifically do if you'd like to get more involved or engaged in some of this work. And we would love for any and all of you who might be interested to do so. So again, we've tried to make it a little bit easier for you to access the link, the specific link for the Navigate Newborn Screening curriculum. You can scan this QR code right here, and it should take you right there if you're interested, or you also can go from the link. But we encourage you to take that curriculum and that training and to share your feedback with us along the way. I didn't mention this earlier, but embedded within the curriculum are a number of different places where your feedback can be shared and provided. And I will say that we have improved and changed things along the way, again, based on what we've learned from families. This is for you, and we want to make sure that this is a tool that is useful and gives families and families like you all exactly what you need when you need it. The other component that I wanted to just briefly share with you, if this is resonating with anyone that's listening in, we do have an ambassador program that we are growing and are looking to always invite others to join and participate in this program. As an ambassador, we lean on our ambassadors to help within their communities share information and opportunity about Navigate Newborn Screening and all of the program activities that we have through the Newborn Screening Family Education Program. And as we grow this network, we're also, again, creating opportunities where ambassadors can connect with other ambassadors, learn from one another, and have just an open community and forum where it's hard to navigate through a lot of these really complex systems. So having a community of support to do that can be very helpful. So if you are interested in in joining or being a part of any of this work, please don't hesitate to reach out to me, and I'll make sure that you have my information available. And we would be certainly happy to have you engage in any part of this program's work. So with that, thank you for giving me the opportunity to share a little bit more and to just lay some foundational knowledge or some general knowledge before we jump into a discussion. And with that, I'm going to turn it over to Amy and Stephanie, and I'm just so excited to hear what you guys have to share.
Thank you so much, Marianna, and thank you to Nikki for inviting us here today. I want to start by just sharing that my name is Amy White once again, and I'm a genetic counselor who currently works in the biochem lab at Mayo Clinic. But prior to this role, I was a clinical genetic counselor at Children's Hospital of Wisconsin for over 12 years, seeing families who had infants with abnormal newborn screens, very similar to our mom, Stephanie Mustin, who is with us today. It's so good to see you.
You too.
And so we're going to kick this off with your story. I appreciate that you're willing to share it. Would you please tell us a little bit more about your experience with newborn screening?
Yeah, so I have a child who's now 9, but was diagnosed with a rare genetic disorder at the age of 5 days. So he actually received his newborn screening abnormality at 5 days. So in a nutshell, Nolan, my son's name is Nolan, and he, again, is 9 now, but when he was born, he did have the newborn screen collected. I didn't know he actually had the newborn screen collected, and I actually have an older child, and I didn't know that either for him. So Obviously, my older child did have it done, but they took the baby in the middle of the night, you're resting, and they do these testing, and you don't necessarily really understand what's going on or being done, and no news is good news. So never heard anything back on Aiden. And then I had Nolan, and he was taken, and it must have been performed as well, because 5 days later, I received a phone call from his pediatrician telling me that his newborn screen had come back abnormal. Unfortunately, his pediatrician didn't know anything about the disorder that he had, and was very kind and said, I'm looking it up right now. I'm trying to understand this better. However, I don't know any information about it, but I did talk to this doctor who really sounds like he knows what he's talking about. And he's at the Children's Hospital, and you need to go there now. And he'll be there ready to meet with you. So I did. And we went in, and we went to the emergency room, because in Wisconsin, you have to go to the emergency room before you can be admitted. So we went to the emergency room. We met him there, along with the genetics counselor, as well as 2 dietitians, who all came in the room in a fury, and we're like, here we are. What are you doing with your baby? Like, we need to know how much it's had to eat today, how much he's pooped and peed today. And they wanted to know all this information. It was very overwhelming. Nonetheless, I learned a lot about newborn screening because of this process. But before that, I didn't even know it was happening. So I think it's really important to realize that it's happening, and why it's important, and how to take care of our kids after we receive a result. Nolan was actually formally diagnosed, I think, six weeks or so after his newborn screen was found. So we did do DNA testing, and were able to get a solution rather quickly, which doesn't always happen with his disorder. So he has a disorder called glutaric acidemia type 1. And that disorder is both rare genetic disorder, and it's a metabolic disorder. Simply put, his body's unable to break down protein, specifically some amino acids that are found in protein. And because he does not break them down, they become acidic or toxic in his bloodstream, and can go up into his brain and cause a metabolic crisis, which is very similar to a stroke. And the area of brain damage that would occur would be in the basal ganglia, which would mean that he would likely lose his ability to control his muscles and his ability to speak easily. So it was important that we understood the disorder, but also that we understood what to do to take care of him, so that we could try and prevent this from happening. His disorder, unfortunately, you can do everything right, and it can still end up with permanent brain damage and still have those negative consequences of his disease. But fortunately, we had some great doctors and great support staff that were able to tell us exactly what to do. So he is on a specialty diet where he gets specialty metabolic foods, as well as regular food that we can weigh and calculate out protein and figure out what he is getting, so he can still grow and develop, but yet so he's not getting stuff that's going to harm him. And then lastly, we have an emergency protocol. So the best part probably of newborn screening is that because it's early detection, sometimes there's preventative measures that can be put into place to help children. So for Nolan, we were given immediately an emergency protocol. And that meant if he was ill for any reason or was not eating and getting the necessary calories he needed a day, this emergency protocol told any doctor anywhere what to do in order to take care of Nolan, since he did have a rare disease and most people are not familiar with it. So in those cases, we could take that emergency protocol into any doctor, and they would be able to at least get started and get him started to take care of him in a way that would hopefully prevent any permanent brain damage from happening. So that then ties back to the reason why newborn screening is so important. Had we not gotten this early diagnosis, I wouldn't have my jumping, bouncing, talking, goofy 9-year-old that I have now. So we're very fortunate that we were able to detect his disease early. Does that answer your question?
Absolutely does. That
long-winded
amazing
answer?
summary. It was great. I think that those viewers out there who are watching this may not know just how serious GA1 can be in terms of the history of it. So without treatment, over 70% of babies would go on to have this stroke and permanent brain damage. But with treatment, we've reduced that to about 25% or less. So it can still happen, but with excellent care, such as you provided for your son, most children do so much better when they're identified by newborn screen. So thank you for sharing that. And so as you highlighted, there are so many parents out there, you included, who don't know that newborn screening is even happening when they have a new baby. So what would you say that you wish you would have known about this if you go back to the beginning of the process after you had Nolan? What would you have liked to know about newborn screening that you didn't
First
know?
of all, I think that you want to know that it's actually happening, and what it's screening for. So my sister-in-law had a baby a year or so after Nolan, and I remember like my brother-in-law is my husband's brother, so like obviously he could also carry this genetic makeup, and then if she potentially did, their children could be harmed by this. So I wanted to make sure, like, hey, you need to make sure this is done, that it needs to be done within the first 24 to 48 hours. Don't do it too soon, don't do it too late, and you'll get your best results. I think that it's just really important to know why it's important, right? Because most of the disorders that it detects, we can help children before they become affected by their disease, either very negatively or even negatively at all. So I think it's just really important for parents to understand why to do it and why it is important. And it's the thing that was the worst with my sister-in-law. She was terrified. She didn't want to talk about it. She didn't want to talk about having an unhealthy baby. She didn't want to even think about it because here she is pregnant. And she's like, well, why would we even want to consider this? And it was really important for me to speak with her and be like, it's okay. It is terrifying. However, the outcome of knowing this information is going to help you be so much more of a better parent, or it's going to just relieve you completely to know that none of those things are going to affect your child, and you can go on and enjoy your pregnancy and enjoy your, first few months of your child's life in a more relaxed way, because you can be certain that none of those things will affect them. So I think it's really important for parents to understand that it's might be scary and you don't want to talk about all those negative things that could happen and could be, but there's so much positivity that comes out of learning about newborn screening and learning about what your child could potentially have as a disorder.
So true. We always said knowledge is power, right? So if you know that something's happening, you can actually take the steps to keep your child healthy, and also notifying family members, as you did, for this genetic condition, which poses a risk throughout the family, is helpful as well. And so after dealing with this situation, which of course your son's doing well, and it's still something that you deal with every day, we know, with treatment, with health, but overall, where have you gone for resources and support in dealing with this? And what's been helpful for you?
Yeah, so for us, first and foremost, we leaned mostly on our team. So our medical team, we were very fortunate to have a genetics doctor who was very good from a bedside manner standpoint, and was very good at wanting to educate parents and make sure that they had all the tools and resources that they had. I will say Facebook can be a blessing and a curse. You can find some Facebook groups out there that are very supportive for parents and are very informative, and you can also find some out there that are not so. So being thorough with investigating which groups you're joining and what the background is. But the one that I am in for parents with glutaric acidemia type 1 is amazing. Like, we share everything on there, what's happening with our children, what we found successes in, where we failed at, where we can find cheap food because metabolic food is expensive. All those things we are able to share with each other, and also share like just your down days and your hard days and what helps you to come back. So I think that Facebook is a blessing and a curse, and you have to be particular about what you choose in those groups and who you choose. Also, there's associations that are existing for like a lot of different disorders. We're on a call with one right now. My son is also part of the Organic Acidemia Association. So he's in Organic Acidemia. So there's a lot of parents that are in that group that have children with a lot of different disorders, but there's a lot of commonalities between those disorders. So we can share stories again there, and find resources there. And then I just have to say, you have to be an advocate for yourself. You have to ask a lot of questions at doctor's appointments. When you're inpatient in the hospital and you're sitting there and there's a lot of people coming in and out, and there's a lot of people doing different things, it's okay to say stop. And I need to know why you're in here and what your function is and what your role is. Because if you don't advocate for your child, no one will. But the most important thing is to be able to say for yourself, it's okay for me to stop. And these are all professional people and should be able to stop and say, the reason I'm in your room is to collect blood. Well, what's going to happen with that blood? I don't know, but you should talk to so-and-so. So you should always be able to ask questions and stop people when you don't feel comfortable.
Thank you for sharing all of that. I think it sounds like you really relied on your team as well as other parents to help you deal with that. And it is so important to advocate as parents. I say this as a genetic counselor who is an advocate, and yet having been in the thick of things for so many years, you know, anything can happen even when your child's in the hospital, and we want you to feel empowered to reach out and talk to people and ask questions because you know your child best. So thank you for that. And what other advice might you have for other families in addition to feeling empowered to speak up that might help them to cope with this diagnosis or any diagnosis from newborn screening?
So the first thing I would say for other families is remember to take a breath and stop. And love your child, because I think I missed out on some moments that I could have just had as a parent. So remember, throughout all of this, it's hard and it's very overwhelming and it's exhausting in so many ways, but don't forget to lay in the rocker with your baby and just take that moment and rock and enjoy and bond and have that immediate time once in a while that you're never going to get back. So I want to say to remember that, like, that was the most important advice I received when I had Nolan. And I think it's important to pass on that you're not going to get those moments back when they're little. And it is going to be overwhelming. And yes, you are going to have to run to doctor's appointments and be everywhere at once. But if you have to snuggle them in the corner of the waiting room. But take those moments when you get them, because you'll never get a chance to get those back. But beyond that, the most important thing for me was that I surrounded myself with friends and family who were supportive. So it's a very difficult time. You're navigating this world that you don't know, and you don't know who to trust and who not to trust. So the ones around you are your families, like that's been with you forever. They can help keep you kind of focused and keep you in the right direction. And then of course you need to lean on your medical team and make sure that you're asking them all the necessary questions. But the other thing that I've always said is that even if I couldn't ask the question, sometimes I would even take my mom to an appointment and have her ask the question. So you can find other people around you that are willing to advocate for your child and for you, especially if you're not doing well and you're not having a good day, or you're just really depressed at the time. You need to be able to have somebody around you that can still support and keep you going. So my advice would be to make sure you surround yourself with people that are going to help advocate for you and for your child as you try and get through that moment.
That's excellent advice. And as you know, I and many other people out there have felt that you're a rock star parent, which is why we asked you to come and give some advice today. So thank you for that. Knowing that this is such a tough diagnosis to have for your child and that there's been so much care involved, I'm wondering if you could share how you have tried to evolve any self-care practices to help you to cope with this during the years.
Yeah, so self-care is not all about going to get a massage and maybe getting a pedicure at this point, because those aren't even on your mind. And I remember having friends that would be like, oh, you just need to take a break and go get a massage. And the thought of like being in a chair for an hour getting a massage was not like even practical in my mind when I'm trying to figure out how to feed him, how to balance his medications, how to balance all of the other things going on and take care of my older child. So self-care for me was not anything about that. More of, I did get therapy. So at 6 months old, I was still crying all the time. Getting in the shower was awful because all I did was cry. Anytime I was alone, I cried, which wasn't often. But driving to and from doctor's appointments was an awful time as well. So I remember going to therapy finally when he was about 6 months old. And I just told the therapist, I just want to stop crying. Like, I don't need therapy. This is never going to go away. I'm not going to be able to fix this, but I need to figure out how to like start to manage day-to-day activities again and feel strong and feel like I can do it without feeling sad all the time. So for that, it was great to be able to talk to somebody outside of the circle that didn't know me, that didn't know my situation, but that could just give me some feedback on here's some tools to make it through the day. On the flip side, my husband was in total denial. He, for the first whole year of Nolan's life, really wasn't accepting of the diagnosis and was wondering why we were doing all these things that just seemed really foreign and really odd, and didn't really make sense in his brain. So I think there was some balance there, and that he was in denial. So he just kind of kept going as normal while I was in this total depressed state and super sad. And so we did balance each other out once in a while, and in that we kind of were dealing with things and coping with things differently. One of the biggest things that helped me though through therapy was I couldn't sleep at night. I would wake up and my mind would be racing about the 10 things I had to do in the morning, the 25 appointments that were coming up, how I was going to go to work the next day with all these other things happening, who was taking care of Nolan tomorrow, because we had this train of grandparents coming in and out. And it was just really a chaotic time. But I didn't realize how chaotic it was while I was living in the moment. So I will say that it was really great advice that the therapist gave me. And it was, I kept a notepad by my nightstand at night with a piece of paper and a pen. So I could just write down what was racing through my brain at 2 a.m. or at 3 a.m. when I had to wake up and feed him again, or whatever it was. I always had a notepad by me. Now it's, 9 years later, and cell phones are a little bit more advanced. So like I actually use the notes feature in my cell phone, and that's where I keep everything. So I have a note section of what I want to ask the doctor at the next appointment. Our appointments are much more spaced out than they were when he was little, but when he was little, we had so many more questions. So that I'm writing them down so that when I get into that appointment, I'm not freaking out like, oh, what were the 3 things I wanted to ask? And then you leave and you're like, oh, I forgot to ask all 3 of those questions. And now I have to wait till the next one. So my biggest thing is to just write down or come up with a system that works for you, where you can kind of compile your thoughts and help yourself to remember things so that you're not sleeping at night when it's the only time you actually do get to sleep. But yeah, I definitely think relying on your network of people around you and your environment of people around you, relying on your doctors, and making sure that when you want to talk to your doctor, they're available, even if they're not available. So make sure that you are reaching out to them and feeling like, hey, I can get the answer I need when I need it, because that will take that level of stress off of you, to not feel so overwhelmed all the time.
Those are excellent suggestions. And yes, the notes feature in my phone, I use it myself as a parent, but what a great idea to have a place ready for you to keep those questions and answers. And so one last quick question before our question and answer session, and that is that you've explained how you and your husband coped with this differently early on. Are there any current present day solutions that you've worked out over time with how you cope with your son's diagnosis as a couple and how you manage things day to day?
Yeah, so we split up his care a lot. In the beginning, everybody's trying to do everything. And by nature, I'm a control person. So by nature, I wanted to control every outcome, and you can't control every outcome. And accepting that was really super hard. So we have both learned, I would say, through this whole process to take things day by day. When it was in the beginning, sometimes it's minute by minute, and it's not even day by day or hour by hour. It's just getting to the next minute and thinking like, this is where we are. We're in the here and now. But for us, I mean, Nolan is G-tube fed, so he still doesn't eat on his own. So I used to do and we do an actual blended diet for him. So I used to do all the blending at night, but Eric would make sure he was doing all the feeds during the day. We set up a tool that we use between the two of us as well to kind of keep track of his care. So I have a spreadsheet we printed out because he goes to school now during the day. So he has to be supported by school as well. But it gives his whole schedule of the day and when he needs his tube feeds, when he needs his medication, and it's all laid out in an Excel spreadsheet, and we print that out, and that goes with him everywhere he goes. So while he's in the morning at home in our care, we check off what we do, and then he goes to school, they check out what they do, and then when he comes back home in the evening, we know where they left off and where we need to begin again. So I think we've learned some tools of organization that have helped us make sure that we're managing his care day to day, but that we're also still able to allow him to go to school every day, and we're still able to go out and do different family events and move about, and he can still enjoy life and not be so controlled by his disorder. But the biggest thing is it is super, super hard in the beginning, and just finding out what works for you and being accepting that each other is going to cope in a very different way, or maybe even in the same way, but that you're going to cope differently, and you have to kind of respect each other's boundaries. But then once you get into a groove and you get into a regular routine, you'll find your new normal and you'll find your new stride, and it'll be all okay. Like we're on vacation. So I'm broadcasting to you live from my car right now because we're on vacation in Washington, DC with my brother-in-law and sister-in-law this week. And you figure it all out, and you still get to go and do those things, and you still just figure out how to do it. It's not as easy as it was to travel with our first child. But we can do it now, and now we do it routinely, and it's okay.
Well, that's wonderful to hear about your present day. I mean, it's so happy for you and your healthy son and your family. And so I know we're at the question and answer session time. And I wanted to just give a couple seconds for us to see if there are any questions and answers that might come in. But first, I'm going to reintroduce Nikki, who kicked us off today, and she will help lead us into the session.
Thank you, and appreciate you both. Stephanie, thank you for sharing your story. Really, it's nice to hear that parent perspective. I think, especially for healthcare providers and advocacy partners that are on the call today, really helps to kind of bring things in for us. Thank you. All right, so I do have a couple questions. So the first one is really just how can we connect with Expecting Health, specifically around the partnership program?
Yeah, I'm happy to elaborate on that, especially just as you said, Nikki. I know that several of you listening in are advocates and maybe a part of advocacy organizations or even other industry organizations. And something I didn't mention earlier, an aspect of the work that we're doing through the Newborn Screening Family Education Program is really trying to reach families. And so we partner with a number of different organizations to do that and to create opportunities for live training or webinars just like this, but also to disseminate some of the tools and resources that we've developed to help families learn and develop their leadership skills in the newborn screening system. And so if you are interested in learning more about that, I'm going to drop my email in the chat box. Please feel free to reach out to me directly. I'd be more than happy to connect one-on-one with anyone that's interested, either at the individual level or at the organizational level, to get more involved. I think it's very evident today that learning from one another is a critical piece to navigating through the newborn screening system. And so much value is brought by hearing stories like what Stephanie shared today. And so through the work that we're doing, we're also doing that as well. So as part of our ambassador program, what we lean on our ambassadors to help us do is share their experiences with other families and connect with other families who may be in different places along that journey and might need help and might not know how to ask for that help or what help they actually need. And so if that's you, please feel free to contact me and I'd be happy to connect more with you on that.
Thank you. And we do have one other question around, how can you find your source of support? And Stephanie, you mentioned a lot of great ways that you were supported throughout your journey. So for someone else maybe that doesn't have family close by or isn't on Facebook or something like, do you have any recommendations for maybe how they could find some other supports?
Yeah, so I really actually started with our genetics counselor. He was the one that provided me the Organic Academia. Like, I didn't know to go and find the Organic Academia Association. That wasn't anything in my wheelhouse. In fact, he had brought it up in an appointment on the screen and said, look, this is what you're looking for. He wrote down the web address and he handed me the sheet and said, here, this is one. And once I got into that association, I found so many more resources within them that they could connect me to. So a lot of times just by finding one good association, you're going to find 25 others just through that. And in addition, obviously talking to other parents and networking with other parents was invaluable because you just found so many other resources from those parents. And rare genetic disorders are hard, and so are other disorders because they don't all act the same way. And so you find out that your child has these symptoms, while this other child has a completely different experience with the disorder. And so you need different resources. But when you get part of these like larger groups, you find that more of a variety there. And so you tend to find a lot more resources. And again, Facebook was invaluable to me. It's scary because you can find the wrong groups, but if you do a little bit of work, you can find the right groups. And finding other parents and other caregivers that were going through the same things as I was helped lead me to other resources. And then your state can actually be a really good resource. So we did all the birth to 3 programs in our state. It's called different things in different states, but basically it's early interventions that children can get from different therapists, physical therapy, occupational therapy, speech therapy, all those interventions that can occur on the front end, which help the children be so much more successful as they grow. But those groups also have a ton of other resources and parent groups and networking groups that they can connect you to get additional resources. So that's another great place to start.
Awesome. Great answer. Thank you, Stephanie. And I would be remiss if I didn't mention the Child Neurology Foundation. We have a peer support program. So if you're unsure of where to start, you can contact our peer support specialists using the contact form on our website. They are actually parents of children living with neurologic conditions. So they have the lived experience and can help you find resources in your community, or if you just need someone to talk to that understands the challenges that you're going through, they are available to you. So let's see, I think we have one question in the box. So Christine and Marianna, this is to you. Can my organization in Kenya also get involved?
That is a great question. I think we should probably connect to talk a bit more. Yeah, the answer is yes. I think we would want to just talk about specifically how and what that would look like. I will say that much of the content and the material that's included in the training I mentioned online is geared towards US newborn screening. But that said, education and family connection are needed worldwide. And so if there are things that we can collaborate and think about to support you through that, I'd be more than happy to connect with you on that.
All right. Well, that is all the questions that we have for today. Thank you all so much for joining. Thank you to our wonderful speakers and Stephanie for sharing your story with us. So the webinar has been recorded and will be available on our website in the next couple of weeks to view or share. So if you have any additional questions for the Child Neurology Foundation or for our speakers, please contact programs@childneurologyfoundation.org. At the end of this, you'll also receive a survey link. So please let us know what you thought of this webinar and also what you would like to see in future webinars. You can also check out our website, and I'll post a link for our peer support program as well. Sign up for our newsletter to receive information about each of our monthly webinars. So thank you again. Have a wonderful rest of your day.